REM Occupational Health and Wellness is an on-site occupational health and wellness company where all services are provided on-site at your place of employment, including imaging. Our mission is to minimize workplace injuries by focusing on employee engagement to prioritize their own health and safety. By engaging employees in this process, we can mitigate injuries in a multi-generational workplace, providing the highest return on investment for each employer. By providing on-site occupational health services, injuries can be evaluated quickly and efficiently, decreasing the need for outside hospital system usage. Our team conducts a thorough investigation into causation and will collaborate with you throughout the entire process. Our team works very closely with Crawford Evaluation Group for their expertise as well.
Crawford Evaluation Group is a leading provider of elite medical experts for the purpose of second opinions. We are highly focused, offering independent medical evaluations and medical record reviews to the workers' compensation claims community. We are consultants for our clients to understand the nuances of each claim and to recommend uniquely qualified physicians on a case-by-case basis. We also take a lot of pride in providing opportunities for education through our legal and medical expert partnerships. This series with REM Occupational Health and Wellness is an example of that. Welcome to our monthly video podcast series. Welcome and thank you for tuning in today. I am David Crawford. Along with REM Occupational Health and Wellness, we've made a commitment to this video podcast series. Today, we will begin this series, Current Trends in Treatment in Workers' Compensation, with two medical experts. Dr. Randall Wojciechowski practices emergency medicine in Stevens Point, Wisconsin. His other qualifications are too numerous to share, but his CV is available upon request. Dr. Wojciechowski will begin our review of COVID-19. Alicia Kelch is a nurse practitioner. She owns and operates REM, Occupational Health and Wellness, and will collaborate with Dr. Wojciechowski on the medical aspects of our topic. Attorney Chelsea Springstead is a shareholder with Linder and Marzek. Ms. Springstead is a prominent figure in the workers' compensation community, defending claims on behalf of the insurance industry as well as the self-insured community. She will be providing legal context throughout the medical presentation today. Let's begin with Dr. Wojciechowski. Welcome.
All right. Thank you, David. And Chelsea and Alicia, great to see you. So it's been quite a year. There's no question about that. We'll be talking about COVID-19, and the first slide talks about how it was really identified, dating back to a little over a year ago. As you can see, we know that it comes from Wuhan, China, and COVID stands for coronavirus. The coronavirus has been around for probably our entire lifetime. I used to tell people to look on the disinfectant wipes, and you'd see that the disinfectant wipes, from 2 or 3 years ago, said that they were effective against the treatment and the disinfecting of coronavirus. So corona gives you the COVID definition of corona, VI for virus, and disease 2019. So that's how we actually came to the realization of the name for coronavirus. I think it may be somewhat redundant, but there's no question. I think it's important that we just go back over the issues with coronavirus, how it spread through respiratory droplets, through sneezing, speaking, talking, close contact. And that's why social distancing has been a term that 1 year ago we certainly weren't familiar with, and now it's in our everyday nomenclature. What are the symptoms of COVID-19 or of coronavirus? They're varied. I personally had coronavirus in October of this past year and didn't know that I had it. About the only thing I had was a headache. And then my antibodies became positive about a month later. I've treated hundreds, if not thousands, of people with COVID-19. You may have fever, chills, cough, shortness of breath, fatigue, muscle aches, headache. Probably the biggest thing that those of you that are listening today who may have had COVID-19 is lost a taste and smell. And that may be varied. I personally didn't lose my taste and smell. My son and daughter who had COVID-19 did lose their taste and smell, and it can last from a few days to a few weeks to a few months. Generalized congestion, nausea, vomiting. And I think what's been very interesting is a lot of the folks that I saw, the elderly folks, had diarrhea and they became dehydrated. Many times that was their only symptom. So the symptoms are varied, and it certainly is. As we well know, it's a novel virus. How do we test for it? The antigen test has been a quick test. Generally, one of the hospitals that I work at, we get the results back in 20 to 25 minutes, but it does need to be confirmed by the PCR test, which is a little more formal and takes about a day. For example, my wife thought because she was exposed to myself and our children, she had some symptoms. We did the antigen test, it was positive, but her long-term test, the PCR test, was negative. And ultimately her antibodies were negative, mine were positive. The purpose of the antibodies are such that we know that you've been exposed and you've developed some immunity. So I don't know, Chelsea and Alicia, have either of you had COVID, or have you been tested? And you also have both of you have different sorts of experiences.
Sure. I've been lucky enough, knock on wood, not to have COVID yet. Hopefully that stays, but I've been tested numerous times. I have family members who have weakened immune systems. So before, starting even this summer, my husband and I, before visiting anyone, we were tested. And it was interesting to see, at least in the Milwaukee area, the changes of testing from last April through today, and how much quicker that process, more efficient that process got in our area, obviously, as testing became more available. And then, enter the same day testing, which I think was one of the tests you mentioned. And actually, I have at home I think it's the Abbott at-home testing. I don't know what your thoughts are on that, doctor, and the reliability of that, but it's an interesting concept, because the tests are only, I think, $25 a test, and you do it with a proctor on your computer, and it's the immediate test. I guess you get the results back in 15 minutes, and they watch you the whole time. You do the swab and all those things, and then they read it. Are those deemed to be as accurate as if you would go actually to a healthcare provider and do those rapid tests, I think we're calling them, or not, I guess, in your opinion?
I think it's varied. I think quality assurance is always important to have a good understanding of what the labs are doing. I do have some reservation about these, maybe some of the for-profit labs where you're paying for the testing. And Alicia, I don't know if you've got any experience with the different sorts of tests. I work in the hospital, so I know that our stuff, there's tremendous quality assurance that's involved with testing. And I think, if I'm not mistaken, I think every day they run controls to be sure that the tests are accurate.
Mm-hmm, correct. In my business, we are doing still some COVID testing, not nearly as much as last year. And you are correct, Dr. Wojciechowski, that the antigen tests, they do vary by manufacturer. It took a long time even for us to find a quality test that we felt had the sensitivity and specificity that was consistent to therefore not give false results to patients who were being screened.
So I think those are all things that need to come into play, especially if there's going to be a workers' compensation claim. We need to be sure that the testing is accurate, that people, for example, if someone is claiming a work exposure, that they are tested in an appropriate environment, and that confirmatory testing is important as well. Just like with my wife, her antigen test was positive, but the confirmatory test was negative, and then her antibodies were negative as well. So I think those are some important things to always consider, not to necessarily rush to the diagnosis. So as we move on, I think a big issue that we've needed to address, and it certainly is a controversy, is the use of masks. We've known that, especially with individuals that are asymptomatic, it did help with the preventing the spread of the disease. I think one of the issues now is for those of us that are vaccinated and who have antibodies. To a certain degree, there's a debate on whether or not you need to be wearing a mask, but I think ultimately we do need to follow the guidelines of the CDC when dealing with this. And I think that's it's important because especially if there is a workers' compensation claim, at least we've got some guidelines that are being followed. And I don't know if Chelsea or Alicia, if you've got any other further thoughts on that.
I'd like to comment though about here, one of your statistics there, about 50% of the adult population can be asymptomatic carriers. In our household, because I was actively around COVID positive patients doing testing on a pretty routine basis last year, I tested myself and my husband every other week. So every 2 weeks, made sure we had a COVID test to make sure we weren't exposing our children or any other potential coworkers. And interestingly, during one routine testing, my husband popped up positive. So he's an example of that individual that completely well, healthy, never experienced a single symptom at all, but was positive via PCR-based testing, which is the gold standard. So if you have individuals out there in the community, like my husband, who had no symptoms and they are not being compliant with wearing a mask and social distancing, you're then therefore precipitating the continual spread of COVID. So just to kind of underscore the importance of the mask usage and, to your statistic point there.
And from a workers' compensation, I guess, angle, mask usage is obviously going to be somewhat dependent on the law. Obviously in Wisconsin, the mask mandate has been struck down more recently. So now it's kind of county to county dependent. I believe it's still in effect in Milwaukee County and Dane County, but not in a lot of the other counties surrounding. So it's going to be up to each employer because the employers can make their own mandates or rules, internal rules and policies, depending upon how much exposure they think that they will have or not. But we'll be seeing that, I think, probably change now that the mandate isn't statewide.
Right. So once again, it's a big debate, and I think it needs to be addressed, especially in the workplace. And we'll talk about that a little bit later on in today's presentation. So, and I guess, in terms of quarantine, I think it's always important to understand that, those guidelines have changed, but if you've been exposed, you shouldn't be in the workplace. You need to follow your local guidelines, follow the direction of your physician. And I think what's really important for the worker that has been exposed, they need to not be in the workplace. They need to be tested in a timely fashion and be able to return to the workplace when appropriate, not to cause the disease to spread. And that those have been issues early on. I think we've done a pretty good job in addressing those issues. For example, at my healthcare organization, we have to do a questionnaire every day before we enter the hospital. We have our temperature taken, and so those are some of the screening tools that are used. But I think what's really been exciting is the vaccine. Once again, I think there's probably controversy over that. The two messenger RNA vaccines, Pfizer and Moderna, have been out a little bit longer than J&J, and as we well know, J&J has now been paused. I personally had Moderna. I got the vaccine, even though I've got antibodies. I chose to get the vaccination. I got Moderna in late December when it became available, and I got my second shot a month later. I had really no side effects, and we can talk about that. But I personally am a believer that I think we should get vaccinated. I think that's the only way that we're really going to be able to address this issue, stop the spread of of the disease and hopefully get our lives back to normal. And I don't know, Alicia and Chelsea, if you've got some other thoughts, we'll talk about. I'll just we've articulated. Here's the Moderna vaccine. Some information about that. There's the Pfizer vaccine. Some information about that, and everyone will have a copy of this PowerPoint presentation, so you can look at the technical aspects of this. And there is a J&J. There certainly are questions. Do we need to continue to wear a mask? What do we need to do? CDC guidelines have changed. How long does the immunity last? I think many of these issues we're not completely sure. A year, 2 years, 5 years, it's hard to really say.
Hey, Chelsea, have you been getting a lot of inquiries from businesses, employer groups, specifically asking about mandating the vaccine, as we've seen some of the larger universities and schools start to already do? Have you been receiving a lot of inquiry? And then how would that potentially affect a workman's comp case if something came as a reaction of receiving the vaccine?
That's a great question. To your point, Alicia, I've seen employers kind of make their own policies regarding this, which is their right as far as mandating it. We've seen it more in different healthcare settings being a mandated option, I guess, not an option, but a mandated requirement in order to return to the workplace. And it may present interesting employment issues potentially down the road. But as far as workers' comp goes specifically, I think it's pretty clear that if it's mandated by your job, then, and we've had a lot of employers are offering it now too on site, that if it's a mandatory requirement and you get some sort of reaction from the vaccine, then that would be covered. That would be potentially a work-related injury. If it's completely voluntary, then that changes things a bit. Then it may depend on if you're doing it, at work, but on your own time after your work shift. I know even in my building, they offered it, on another floor. You could go before or after work or set up appointments during your lunch hour, but, kind of not during your work shift. And that takes it kind of out of the realm of workers' comp. Now, the gray area is if it's voluntary and offered, as a completely voluntary option, but is during your work shift on the premises. And there's an argument that brings any side effects within kind of the positional risk doctrine in workers' compensation, Wisconsin, which basically says that, you are in a particular place in a particular time when you were injured at work. And so whether or not, even though it's voluntary because you're on the clock and on the premises that it has been offered by the employer, that could bring it back into the realm of workers' comp. But thus far, it seems like, other than obviously the Johnson & Johnson, I mean, you guys would know more about the side effects we're seeing, but the cases we're hearing about is maybe someone needing the next day off, it seems like, just like a 24-hour period, and then being able to return. So it's from the workplace exposure aspect, it's pretty minimal. Obviously, the 6 or so cases that Johnson & Johnson have are quite extreme, and that would take it. But arguably, if those people were mandated, then, I know there's been at least one death that could have been a workers' compensation case. Are you seeing any other side effects that, are lasting more than a day, or are those kind of the outliers?
We have not, and I'm the associate health medical director for Ascension, Wisconsin. We have chosen not to mandate it among healthcare workers. We certainly encouraged it. One of our paramedics took a day off. She was kind of sick the next day with fever and chills and aches and pains. But I haven't really seen a lot, and I've not evaluated any. At least there has not been a plethora of cases that have required my intervention to look at these folks. Like I said, it's really been symptomatic. People have felt a little crummy. I felt after my second shot, I had kind of an unusual headache. I took some Tylenol and ibuprofen, and I took a nap for about an hour, and I felt fine. A friend of mine, who's a general surgeon, was down for a day. But it's varied. But I think Chelsea, as you said, it would certainly be compensable if we had mandatory vaccination policy. And it's hard to say what's going to really happen. Our position at Ascension at this current time is that we will not be doing that, but that may change in the future. We do have mandatory flu shots, and there certainly are waivers then that I become involved with for our associates if they choose not to get it. So you can see on this slide, this is probably some of the most common things that we've seen with the side effects.
And to your point, doctor, this would be treated from a legal aspect similarly to flu shot. I mean, it's the same. We're getting these questions on a larger basis now because obviously, the COVID vaccine is kind of new and out and being pushed in a larger amount than maybe the flu shot, but it's the exact same, legal standard.
Right. So, well, good. Well, I think, we've been talking a lot about work comp, and I think responsibility comes down to the employer and the worker. The employer needs to provide a safe environment, and the workers need to take responsibility as well. And this all comes into play in terms of OSHA and other issues. And I think what's important to understand is the potential for exposure. The cases that I've personally seen in terms of work comp have been people who have high potential for exposure. And you can see healthcare workers, laboratory workers, our frontline workers. And these people are certainly at greatest risk. And there have been a couple claims that I've been involved with through my medical legal practice. So I think it's important to understand that the employer has to provide the appropriate tools for protection. The employee needs to follow appropriate protection rules as well, so that they don't get it. And I'll just run through a couple more slides. I mean, you can see the people who are at the highest risk: healthcare workers, law enforcement people, anybody who's really providing any sort of patient care, whether it's in the medical arena, psychiatric arena, home health care. All of these folks are at risk, and we certainly know that folks who've been in long-term care facilities, that's been an issue, and we've needed to protect those folks. I think once again, I think it's important. There isn't a day that doesn't go by that I don't have to gown up like this. And we're still doing that, but fortunately, I'm seeing less of those cases now than I was 6 months ago. So it's made my life in the emergency department a little easier. And once again, I think just for your own edification, these are some of the potential folks that are at risk for at least exposure, and they're a little lower impact as opposed to the people in the office setting. So I haven't really seen in terms of independent medical examination, I haven't seen cases for the potential for low exposure, mainly just the office workers, because that really becomes a question: is where were they exposed? So I think let's open this up. I mean, there's all sorts of things that we need to consider if someone does come down with COVID. How do we handle this? It's really it's difficult. And Alicia, you're certainly on the receiving end of the occupational medicine arena and the post exposure, and then Chelsea, and I think you're probably getting involved once a claim is filed. So any thoughts on this? And there's a bunch of things that need to be considered.
I think one of the most important things I've seen play a really important role is for organizations to have a really good contact tracing system. So first and foremost, having standards at work where they are held to, so mask usage, social distancing, and then if there is a potential infected person at work, doing a really thorough job of contact tracing. So thankfully, the organizations that I'm working with have both of those in place, and they are very good at doing their contact tracing and establishing if there was the potential for a risk of exposure or whether there was not. So I would highlight that for organizations as being two of the most important factors from the get-go in helping to establish causation of the infection.
And from a legal aspect, I've actually I feel like we've seen a change in things as COVID testing has become more readily available. And now it's becoming a little bit more complex as things are opening up. Because I mean, early on in the virus, if you go back a year to last April, COVID testing was almost non-existent. Trying to get your hands on it was, like gold, I feel like at that point. And the diagnosis were all kind of across the board as far as, what was COVID, what if we could tell if it was the flu or not. So extreme cases were being diagnosed, but a lot of the minor cases, weren't, and people were being told, don't go into the doctor, don't overload the system, I guess, at that point. And so from a legal standpoint, it's a preponderance of the evidence standard for infectious diseases. So whether or not a preponderance of the evidence shows that you contracted it at work or not. And initially the cases we were getting are, have they been diagnosed with COVID? Because if they're not being diagnosed, there is no injury. So it was a little complicated because there weren't, the testing wasn't available. And people were being told not to go in, yet they may or may not have had COVID during that time. Now, but if they were exposed at work, if they knew somebody else they were working with, especially essential workers at that time, had COVID, it was easy then as far as contact tracing because you knew who was there, and these people were only really going to work and back because everything else was essentially closed. Now you have testing that's widely available. So now showing that there is or isn't an injury is the easy part. That they have COVID or not, they can easily get tested and pretty quickly. But as things are opening up now, the whether or not they were exposed at work becomes more questionable. And I guess makes it a little bit easier, these cases to be more easily deniable, on our end as workers' comp, because if they can't show, if they don't know that anybody at work had it and they're at work, but now they're also going to maybe baseball games or, little leagues opened up again, family parties are starting to happen again, group gatherings, people are going on spring break. There are other states that are, completely open to some degree. So there are a lot more factors now as far as outside exposure that have to be investigated, I think, from a work comp standpoint that makes, complicates that. And beyond that, what kind of an interesting aspect that we're seeing now is the post-COVID symptoms. So you had, your whole host of COVID that we've been dealing with last year. Now you have people who are dealing with, what may or may not be diagnosed as post-COVID symptoms. And from our angle, from the legal aspect, that's been tough because those symptoms are all over the place. I've had people claim stroke-like symptoms, slurred speech, neurological defects, cardiac issues, lack of, weakness in lower extremities, loss of use of extremities. I mean, it's all across the board. And how do we know what of that is actually due to COVID versus a pre-existing or personal health condition that may have manifested or gotten worse just, in the months after this person convalesced from COVID? I guess, are you seeing? What are your thoughts?
Well, I'd like to talk about a couple cases, and I think what's important to understand is as we look, all the things that you brought up, Chelsea, about the issues in terms of causation. I think what's really important, if you look at this slide, prevention in the workplace, we need to be sure that the employers and the employees are appropriately practicing prevention, because that makes it very simple, as opposed to if they don't have policies and procedures in place, it makes it very difficult. I think in order for an individual, say, such as myself, such as you, Chelsea, or Alicia, looking at where this happened, are there appropriate policies in place? Are they cleaning the workplace? Are they practicing social distancing, wearing masks, whatever? So I think all of that is really, really important. Some of the issues I've seen, people like working from home. And they're really upset when they're made to come back to work. And I think that some of those psychosocial issues have come into play. I think it's important that the workers should feel safe. They've got the opportunity to appropriately file complaints, and they need to feel safe in the workplace. But I think as we start to wind down, there's been so many things that we've talked about that I think are important. I think individuals should get vaccinated. Once again, that certainly helps with the spread of the disease. But granted, the employer cannot mandate them, at least at this time. But I think it should be recommended, and hopefully we're all champions of recommending vaccination. But I think these are the things that I, over the next several minutes, I'd really like to, to talk about. Is as we summarize this, what is the risk for exposure? Are there appropriate policies and procedures in place? And Alicia, I don't know if you've been involved. You've been involved in writing any of the companies that you service with policies and procedures to be sure that we've prevented the spread of COVID.
Yes, absolutely. So I sit on a couple of different safety boards for the various organizations that I work with to do just that, to develop policies and procedures to ensure that the workers are all safe, that we're abiding by CDC guidelines and trying our best to limit transmission and spread of the virus.
And Chelsea, have you been involved in any are you writing any legal documents in terms of policies and procedures for companies that you represent?
Not specifically. That's kind of more handled by the employment attorneys at our firm. That tends to get policies and procedures for employers, tends to get into their expertise, so to speak. But yes, our firm has been involved in that, and I've seen different policies and procedures put in place or expounded on, I guess, current policies.
The big one I'm seeing now, Dr. Wojciechowski, is how to navigate now the post-vaccine. So now that we have vaccines, do companies continue to pay for their time off if they had an exposure and they need to quarantine because there's a vaccine available? Do they withdraw those benefits? How do they handle side effects from the vaccine, insofar as making sure that they're allowing them time away from work to have access to it and then covering their time off if they're experiencing side effects from the vaccine. So that's kind of where it seems the focus has shifted. We're still very much heavily involved in the prevention piece, but it seems as though now it's heavily related to the vaccine side.
Yeah, and I think that's such a difficult, difficult issue to address, and it really comes down to the legal arena. I'll tell you about a couple of IMEs that I did. I had an individual. She was a activity director in the state of Michigan, and Michigan is a little bit more liberal than a lot of the other states. For example, if at least early on, any healthcare worker that came down with COVID, whether or not they were exposed at work or not, it was considered a compensable injury. And so these people, they all of the work comp claims were filed. So that was kind of interesting. But I saw this gal in Michigan who was an activity director for, I think it was an assisted living, a nursing home, and the COVID was out there, and she was upset with her employer because she didn't feel that they had adequate protection, and she was, made to come into work. So there were a lot of other psychosocial issues. She weighed 350 pounds. She ended up being hospitalized, had significant, it was in her 30s, but had significant medical comorbidities. She was a diabetic, high blood pressure, high cholesterol. And she did indeed have some problems, but 6 months out, it was very clear when they came in for the independent medical examination that they were ready to go at it. The husband came in and he had to lead her in, and I saw surveillance stuff where she really wasn't that disabled. She told me she was desaturating, her oxygen concentration was dropping in the 80%. And, Yet even right after she walked in, I checked it and she was at 98%. So she did have numerous medical comorbidities, but enough. I think enough is enough, and I did place her at end of healing. And Chelsea, you mentioned that the post-COVID stuff. I mean, those are big, certainly big issues, and then it ultimately, I think, comes down to what you're going to do, Chelsea, and how they're going to mitigate that claim.
Sure. And you mentioned in Michigan, the presumption. Many states have COVID presumptions. We do not in Wisconsin. We kind of had a short-term presumption in quotes. It was called a presumption back in April. It has expired months ago. And even then, it was frontline workers who came in contact, but you had to show a positive COVID test and actual exposure. So it kind of went beyond, what Michigan and other states have. So, from employers' perspective, that has been kind of positive, I guess, in Wisconsin, and that there isn't a presumption that we have to overcome on the defense side of things. But from your standpoint, then, doctor, as far as when we're setting up, these IMEs, especially with post-COVID symptoms, what can we do to give you, the most information possible, I guess, to make a clear diagnosis as to whether or not it's pre-existing or kind of a post-COVID? Obviously, it seems like pre-existing medical records would be extremely helpful. Would you suggest surveillance in those types of cases, or what else have you seen that's been helpful?
I think it's. I personally always loved surveillance, and I had a very interesting case on Friday in a major metropolitan area of a police officer who a year ago was exposed to COVID, was not hospitalized, unlike the gal in Michigan who was hospitalized. She was I think she was even on a ventilator for like a week. But this guy had minimal symptoms and had some fatigue and whatever. And he's a police officer. He's been off of work for a year. The city that he works in is extremely contentious right now in terms of the police department. So the very interesting thing is he came in, and his father's a physician, and he was brought in by his father, and the guy looked homeless. He hadn't probably cut his hair in over a year. He had a beard out to here. I mean, he literally looked like a mountain man. I took his mask off, and I mean, the hair, I mean, he hadn't even trimmed his mustache. I wasn't sure how he could eat. And I mean, he hadn't bathed, and it was really kind of crazy. I thought, this guy really has some psychopathology. And I questioned whether or not it was pre-existing. And then I went back through the records. He claimed everything, as a result of this, isolated event. He told me he was having fevers of 103 and all these symptoms that just none of it made sense. It was from a year ago. Well, the guy had tremendous psychopathology. He had been in the military. He had post-traumatic stress disorder. He had substance abuse orders. He was an alcoholic. He was a young guy. He was 28, and he was shaking. So I mean, I think the guy is still probably abusing alcohol, and he's related everything back to that. And, I went through the records, and I mean, there was clear documentation dating back to 2011, and I had excellent medical records, and I had military records that I was able to look at and determine that none of this made sense. What always fascinates me, on all these COVID cases, people tell me brain fog. I can't remember anything. I've lost executive function. I can't do anything, yet they don't miss a detail on when they were exposed. They can tell you, they can articulate every medical record. So that doesn't make sense, and there's secondary gain in a lot of these cases.
Have either of you seen an increase in the mental health claims associated with COVID? Have you seen from either of you, Chelsea or Dr. Wojo?
Just from my perspective, it's usually tied into that there is some mental health issue.
Yeah, I was gonna, when the doctor brought that up in his last explanation, of that patient, that's what was triggering to me is COVID and stay-at-home orders and people working from home or losing jobs. I mean, that has affected everyone's mental health, and not all of that is work related. COVID itself has been very damaging, just this last year on people's mental states, and I think we're starting to see more of that. But in the work comp realm, Dr. Wojciechowski kind of hit the nail on the head. We're seeing it kind of interwoven with these physical symptoms, and whether or not, what came first, the chicken or the egg is what the hard part is, what we're trying to untangle, I guess, at this point. And whether or not it's actually related to them having COVID or just, the experience that this year has been, which has been quite traumatic for a lot of people.
And it certainly has, but I think, as we wrap up, I think it's important, to our work comp adjusters out there to be suspect. I mean, you need to be compassionate, but to be suspect, I think to procure appropriate records. I mean, if something doesn't seem right, it probably isn't. Just like in a couple of these cases that I have seen, I think adequate medical records in order to assess the situation. For example, this police officer that I saw on Friday had, he had seen all sorts of specialists, and every workup came to a dead end. You're going to see some inflammatory markers. You're going to see some things that are there, and so if it doesn't make sense, it probably there's something isn't quite right. So I think it's important that, in terms of, these cases, they need to be appropriately investigated and thoroughly investigated, and to be sure that someone with a good forensic background looks at this and just doesn't accept this for face value.
All right. Once again, this is brought to you by REM Occupational Health and Wellness and Crawford Evaluation Group. We will now take some questions from the presentation, but before we begin our Q&A, I'd like to apologize for an error I made during the introductions. Alicia Kelch is a physician's assistant. I mistakenly said nurse practitioner. Apologize for that, Alicia. And also, I wanted you to know that her team at REM came into our office and did a wonderful job vaccinating our staff here at Crawford Evaluation Group. So they're the perfect partner for companies looking for COVID-19 resources. We've received a lot of questions. Many of them are overlapping, and some of these questions are difficult to answer perfectly as it relates to work comp, and that's why we're determined to continue to explore this. One of the first questions, Dr. Wojciechowski, do you anticipate COVID-19 will become seasonal like the flu?
I think it's certainly a possibility. I don't think we really know, but the coronavirus is a respiratory virus, so there may be some variants, and the jury's not out. And this disease is just so crazy, and it continues to change. So I don't think we really have an answer.
Just reading the newspaper this morning, I saw there were 688 new cases in Wisconsin yesterday and 34 new deaths. So we're certainly, not always heading in the right direction. What is known about the new strain or variant of COVID-19, and how can we understand that better?
Well, I think from the medical perspective, I think we're still evaluating it. I'm not a virologist, so I have not looked at any of that literature in terms of the chemical structure and how it's responding. My understanding is that the vaccines, though, are able to deal with it. So I think that's good. And I don't know, Alicia, if you've got any other thoughts on that.
That was my understanding as well, is that the studies that Pfizer and Moderna have done so far about the variant strains have proved that they are effective against those variant strains. My understanding also is that both Pfizer and Moderna are actively working on booster doses specific for these variants. Moderna is actually in the process of doing their clinical trials on it. So I think we can all rest assured that if they aren't fully effective right now, that all of the drug companies are actively working to make sure that we're protected against those as well.
And while you're at it, Alicia, did you have any thoughts about the Johnson and Johnson vaccine, or Dr.
Um,
Wolf?
yeah, I did see that it was, reapproved for use again. My hope is that people are not dissuaded from getting it because it still is a wonderful vaccine. Statistically, if you look at the amount of cases that they had with the significant adverse reactions, there were, what was it, 6 out of almost 5.5, 6 million. So statistically, that's very, very low likelihood. So I really think that weighed heavily in them reapproving J&J. And I don't know, Dr. Wojo, if you want to add to that.
Well, I think the CDC is extremely conservative, so I think it's important to understand that they wouldn't have released it again. I am not aware of anyone that is using it today. I think it was reapproved for use in the past 3 to 4 days. The issues were, and there were 6 cases out of 6.8 million. So, very, very small percentage. It was all in females. The females were between the ages of 18 and 50, and they developed this this clotting issue. So, there's caution should be probably in administering it to females who maybe have some sort of blood dysprasia, blood disorder. You probably should be very careful in considering whether you take Moderna, Pfizer, or the J&J. I think the recommendations are going to be if you're a female between the ages of 18 and 50, that you may best be served by another vaccine. But it should not, it's unfortunate. I think it came at a bad time. We shouldn't dissuade people from getting the vaccine.
And
I think I was just, one other thing. I had a call from a pilot today. I'm a senior aviation medical examiner for the FAA, and this guy is conservative. He's a little bit afraid. He's a young guy. He's healthy. And his company is going to mandate him because he's got a bunch of European trips coming up. So he called me and said, "Hey, Doc, I just want to talk to you about this. I'm a little concerned about getting the vaccine, and I'm supposed to be flying to Europe starting in the summer, and they won't allow me to go. And so what do you think?" I said, "Definitely do it. I think it's safe. Granted, we don't know what's going to happen in 10 to 20 years, but I would say that's rather unusual and likely that we're going to see side effects long term. So once again, I really recommend it. So I'm sorry, Chelsea, to cut in on you.
No, I appreciate that information. I guess just taking a step further on the Johnson & Johnson, you had mentioned potential recommendations. Do you know if the CDC, I knew they lifted it, but I haven't, actually looked into that. Do they provide guidelines? Because my understanding, at least here in Wisconsin, when you go to the Wisconsin Center, you get what you get. Or if a healthcare provider calls you, when you get there, they're like, "We're doing Pfizer today, we're doing Moderna." You don't really have a choice to say, "I'm a female between that age range. I don't really want it." The Johnson & Johnson, you either get it or you kind of go back in line.
Right.
Do you know if there's going to be some sort of sorting out process with that, or?
The original, I read the original position piece from the CDC, and it just recommended that females between the age of 18 and 50 utilize caution. They always say, "Well, discuss it with your doctor." So I really don't know. I'm not aware. I'm in Stevens Point, so I know that Metro Market. I think Walgreens are utilizing Pfizer. My healthcare organization, Ascension, is providing Moderna, and then I think it's across the board. There were other healthcare organizations utilizing Johnson & Johnson. I am not sure what they are doing. I have not heard anything just because it's new. It's been in the past 3 to 4 days.
Sure.
One other question here that we were discussing during the break was the pandemic relief bill for first responders, and we thought Chelsea could speak on that.
Yes, there's a COVID-19 pandemic relief bill that was passed by the legislature and Governor Evers back in April. I think it went into law April 15th, and it was kind of backdated to anyone who was exposed or to COVID as of March 12th of 2020. Now that relief bill has long since been gone. We call it the presumption in Wisconsin. It's kind of the closest Wisconsin got to a presumption law. It should be noted that many of our surrounding states still have presumptions in place, and much stronger presumptions. Wisconsin was one that didn't, which was a benefit to employers. That relief bill, I believe, ended around June 12th of 2020, but at the time it stated if you're a first responder, which included everyone in the medical field as well, or dealing with medical issues, and you could show that you were exposed to a confirmed case of COVID-19 through work, through the course and scope of your employment, and you had either a COVID-19 diagnosis, because at the time this went into place, testing wasn't as readily available, or a COVID-19 test, then there was kind of a rebuttable presumption that you therefore got it at work. It's interesting. I know some on the applicants bar, would say that's a presumption in quotes because they still had to prove, 2 or 3 things, confirmed exposure at work and confirmed testing of COVID in order to even get to that rebuttable presumption. And it could still be it's rebuttable, so it could still be rebutted by other evidence. But it was what Wisconsin had in place. So now, post June of 2020, technically, even if you have exposure at work and proven that you then contracted it, you don't have that rebuttable presumption anymore. So work comp carriers, may be able to find other ways to deny the case depending upon the facts, at least for first responders.
Well, I think what's so important are the facts, and a lot of the COVID IMEs that I've completed already have been on healthcare workers. And, one of the questions that I see, if you remember back a few slides ago, I showed you the picture of the PPE. So we're wearing an N95 mask, we're putting on another surgical mask, you're putting on, many times you have a hat on and, a hair covering, you've got a face shield, you've got a gown and gloves, and you deal with that. For me as a physician, I'm kind of in and out of the room, so I'm donning and doffing. But our nurses in the emergency department, or my daughter who's an ICU nurse, they're wearing it around the clock. So the one thing that I just question is, if you're taking all these precautions and you're washing your hands and disinfecting, and we've been so vigilant over the past year, how are you getting exposed at work? How are you not getting exposed at the Kroger or Metro Market or Sendix or, Fleet Farm or wherever you are? So that's why I always raise that question. Just because, you're working in that environment, it doesn't mean that you've been exposed there. And, when I'm asked so many times, I just say, I'm unable to opine to a reasonable degree of medical probability that this person was indeed exposed at work. And, I raise that question. So I would encourage all of you to at least ask that question, because I think it's out there.
Would just from cases that, I've heard about or had or been involved with, would your opinion be any different if, let's say, 10 healthcare workers in the same area all came down with COVID around the same time after an exposure, even though they're wearing all the PPE? At what point does the needle move one way or another?
I don't think I can give you an answer. I'm very forensic. I really look at all the factors, and if it doesn't make sense, something's not right. I have not seen that, where we've seen an exposure of 10 people, within within a healthcare organization. We've certainly seen it with patients in nursing homes, where it's run rampant throughout a nursing home or an assisted living. But as long as precautions have been made, I just always question that. It just doesn't make sense. And there are so many other factors that, at least in the cases that I've seen, and granted, the cases I'm seeing are skewed. But the police officer, I saw a nurse practitioner that was an ICU nurse practitioner, and she had asthma, so it just worsened her asthma. So I wasn't able, I can't say that she was indeed exposed at work, but her asthma condition did worsen as a result of her COVID. There was no question about that. I saw an LPN from a nursing home that just became markedly deconditioned, but he was 66 and obese and diabetic and multiple medical problems. So all those factors come into play. So, there just isn't the right answer. It's not like with a sprained ankle or a broken leg that, that sprained ankle is probably going to be healed in about 6 weeks, or broken leg in a couple months. So you have to look at it. And, and everybody is aware of all of these quote unquote post-COVID symptoms, these unusual symptoms that a lot of times it just doesn't make sense. The cases I've seen, the stuff hasn't, it ended up.
Oh, I think we lost the doctor. But I mean, I think he made a good point as far as from a legal aspect that we got to take these cases on a case by case basis and kind of determine in each case what the exposure was and whether there was likely exposure outside of work. And I think it's interesting because it is an infectious disease case, legally, technically, but your typical infectious disease cases, the exposure outside of work isn't, if you have magnesium poisoning or, those sorts of things, the radium, the exposure outside of work is more limited in scope versus COVID. Oh, he's back. Welcome back, doctor.
Somebody cut me off. I actually bumped my keyboard.
I was just reiterating kind of what you said, that I agree from a legal perspective. It really is a case by case basis, and you have to, determine all of the factors, and that because there could be exposure anywhere, especially as the world reopens, it's harder to, narrow down when that exposure was.
And if you're going to investigate a case, that was another one of those questions that was asking what should be involved in your investigation.
From my perspective, the initial investigation, I mean, is similar, the doctor kind of hit on a lot of this is, what other exposure did the person have? Where are they working? Was there proven exposure at work? I think if you're a truck driver and you're working with, another driver and that person tests positive and you were just with them for a weekend and they call you after, after your shift and said, hey, I had some symptoms, I just tested positive. We've been in a cab of a truck together now for 2 days. And then that person tests positive, trying to link it to sure they could have gotten it at the grocery store or somewhere else. But now you have close contact in confined space without PPE with a, co-employee who tests positive. I think that's a harder one to defend against than, someone who's like, well, yeah, I work at a grocery store. I don't know anybody who's gotten it, but I have it. I think I got it at work, but I also have 4 kids at home who go to school and my wife, goes to work and I'm, out and about. I think that's, kind of more easily deniable. So I guess in my perspective, that investigation, what are their hobbies? Investigating, do they work elsewhere? Who lives with them? What do those people do, as far as work, school, who are they exposed to? Where you live, whether or not you're wearing masks or not, I think can be useful as well. Because even with the mandate, it's well known that there are some areas in Wisconsin who, and the mandate obviously is no longer a thing, but even when it was mandated across the state, there were areas that were complying and some weren't. So, I saw cases in the areas that weren't complying, where, if people aren't wearing masks, that's something that could be useful to your investigation. Talking to coworkers, has anybody else been positive? Social media is a good aspect as far as trying to figure out what else people have been doing. Because everybody, claims to have just been quarantining and holed up for the last, year and a half. And then all of a sudden you get them in social media out at different, barbecues and, situations. But is all of that information, as far as an IME doctor that would be relevant to you as well, beyond just the medical aspect of the cases?
Yeah, absolutely. I mean, information is really key. When you're looking at it and being forensic and, seeing, for example, what Alicia's seeing in her clinic, if she's seeing these people and they're going on to an IME, I think the documentation is very, very important. So, and many times there's that background information because when I'm seeing that, I'm not getting the complete story. And, and as I've said 1,000 times, a cover letter, if it is an IME, the cover letter is important, citing these issues so that I can potentially ask, how was your, child's 16th birthday party and something like that. So, all that stuff is very important. There's never too much information.
Excellent. Well, I think we've reached our hour. I'd like to specifically thank Pixelbox Studios and Paris Prokopis for producing today's video webcast. I'd also like to thank our guests for their contributions. Stay tuned for more information about future episodes of Current Trends in Treatment and Workers' Compensation.
Thank you. Bye-bye.
On behalf of Crawford Evaluation Group
And REM Occupational Health and Wellness, thank you for joining us today.